My name is Dr. Andy Joshi, and I'm giving this video to you as a presentation which is confidential and a draft copy. The topic is peripheral nerve stimulation. Just a disclaimer, this video is informative only in nature, not intended to serve as medical advice or a recommendation for care. Please consult with us or your doctor to discuss whether this procedure is right for you. So there are a number of clinical trials that have been done. Just click clinicaltrials.gov and look for peripheral nerve stimulation, or PNS, or you can use the Sprint logo to find these trials as well. Additionally, Sprint peripheral nerve stimulation has been studied at some major universities. Here are two universities in California, medical centers that have had published some data, and this data is available all over the world. So, how does Sprint peripheral nerve stimulation work? The theory behind Sprint peripheral nerve stimulation is not new. It was actually developed in 1965 by a group known as Melzack and Wall, Dr. Melzack and Dr. Wall, who talked about the gate control theory of pain. So Melzack and Wall developed this hypothesis of the gate theory, or the pain gate, which is depicted in yellow in the middle of the screen just to the right. So that's a yellow depiction of a pain gate. If you look at the top left, in red is a painful stimulus that goes with the arrow to the right through A delta and C fibers, which is what it says in small print, and through the gate and to the right to the brain as a red painful stimulus. If you look at the bottom left, a non-painful stimulus also goes to the same gate, and a non-painful stimulus being either light touch or vibration, or a change in temperature, or in this particular case, the Sprint peripheral nerve stimulator, or a TENS unit, or interferential unit, etc. So the non-painful stimulus goes through the same gate and gets transmitted to the brain as well. And in the gate theory, if the non-painful stimulus is overwhelming, then the painful stimulus will not get through the gate and gets trapped in the gate, then does not get transmitted to the brain. So that's the gate control theory. So here is a diagrammatic depiction of the gate control theory, where the painful stimulus and the non-painful stimulus are competing for signals to the brain. So if a person had a headache, we would just need to find the right nerves that would transmit a non-painful stimulus that overwhelms the painful stimulus, at least in theory. Here is the shoulder. If you look at that central figure on the left, there's a star next to the shoulder. And for that person, finding the right nerves that compete with shoulder pain, which typically in the shoulder or peripheral nerves are the axillary nerve and the suprascapular nerve, not nerves that you would need to memorize, but nerves that your doctor would need to understand fully in order to block the signal. It's the same theory in play here as well. So the gate theory developed in 1965 has led to all of these innovative products like TENS units, which now are available at every pharmacy and even on Amazon, and the units that you see here, some of which can be electromyostimulators or interferential units, and there are some even more advanced units available now. And on the other end of the spectrum are these spinal cord stimulators, whereby a wire is placed inside the spinal canal and advanced towards an area of the spinal cord, and the signal is released, which indeed competes with the pain signals and blocks the pain signals using the same gate theory of Melzack and Wall. So this is on the other end of the spectrum. So what we needed was something more in the middle of the spectrum. And that brings us back to the Sprint product, as you see here, which is essentially a flexible wire connected to a battery and a programming device that is somewhere in between the TENS unit, which lies on top of the skin, and the spinal cord stimulator, which lies inside the spinal canal. This simply sits on top of whichever structure we're trying to get pain-free, such as a peripheral nerve. So this product is somewhere in between the TENS unit and the spinal cord stimulator, but based on some of the same simple theories. So let's get right into it. What is peripheral nerve stimulation, or SPRINT? If you look at the logo on the right, that is the battery pack that's simply taped onto the body. In the lower back region, you see a person who has some redness that is the area of pain, which is colored by an artist. And in the middle, you see a hand at the bottom. That is the wire or the lead. So on the top right, the battery pack connects by a wire that you see in the middle picture, and it inserts itself on the left in any region or where there's pain. So the doctor's job in this case is to identify the nerves in that region that would benefit from stimulation and simply take a small needle and put the wire in that region. This does not go inside the spinal cord. It is not a major operation. It can be done safely in the office. And again, the glove on the right is holding a SPRINT lead, which is implanted. In this case, the battery pack is taped to the shoulder region because that's where the target is for shoulder pain. And in the right side, you can see a person holding the implant. You can barely see it without magnification. For some of the remaining pictures, we'll need to magnify this lead just so it can be seen. But for now, it's good to show how small it is. This is a depiction of, on the right, you see a coin just as a point of reference as to how small the needle is. But if you'll take a look right at George Washington's left ear, there's a small little sliver of hook, which I've tried to magnify as much as possible. But that little hook prevents the needle from popping out when it's in your body for 60 days. At times you can actually shake it so much that that sliver breaks off. Not considered a major medical problem. If we need to, we can fish it out. Most patients, after realizing how small it is, will just choose to leave it there. And then every time you have an MRI, you just need to tell everyone that you're MRI conditional. Which means you can have an MRI, but there are conditions to it because you might have a little tiny sliver that's left. Most of the time we are able to remove the sliver, but there are rare times when that little piece just ends up being trapped underneath a muscle. Again, it can be left there indefinitely. It just changes your MRI compatibility. But most of the time there's no issue. That is a known complication that we want you to know of. We do not put this needle inside a spinal cord or inside a major organ. We simply place it in the muscle belly next to the nerve, and it's not even in the nerve. It's next to the nerve. And so on the left side you can see that these yellow areas show that the needle tip has a circular area of stimulation, so that the circular area of stimulation basically means that you don't have to be in the nerve. You can just be next to it or near it. It's called near field stimulation, and it works just as well as directly stimulating a nerve. And you can see that on the bottom row, the brain has color changes, and those color changes in the brain represent how near field or stimulation of the nerve can affect the pain structures in the brain. It's very similar to a TENS unit, but more implantable and removable, entirely removable except for any known complications where that small little sliver can stay inside you. Great. Now for the lumbar spine, we have overly magnified the size of the needle to show the bones and the spinal canal and the needle as it approaches the medial branch nerves. These are the nerves that you've heard of before, the facet nerves, medial branch nerves that you can burn or break or radio frequency or block. Again, on the right, we've overly magnified the shape of the needle or the probe so that you can clearly see what type of device is being implanted. Great, so how does the needle get placed into these areas? One way is to use an ultrasound device, and on the right side you can see the ultrasound areas where you can clearly see the occipital artery and the nerves and bring the device close to you. Another way to implant the device is to use X-ray beams. At times your physician may choose to use X-ray rather than ultrasound. It just depends on what the physician is comfortable with or the exact part of the nerve that needs to be approached. So just to make sure that we didn't accidentally scare anyone with that long needle, that's the needle that gets placed into your skin and into the subcutaneous structures. It's not the one that stays inside you. The product that stays inside you is this thin, flexible, strong wire with that little fine tip at the end that I showed earlier. So just to bring everyone back. On topic, this small wire that you see between the fingers is the only wire that remains in the body, along with that very, very thin tip that we showed earlier that is the small hook. The large needle I showed in the earlier slide is placed under anesthesia into the structures that are needed to be freed of pain. So just to bring everybody back on topic. This is the thin, flexible, but strong wire that you see between the fingertips. That is the only part that remains in the body after the placement. In the other picture, I showed the battery pack, which remains outside. I showed the needle, which is used to guide this small flexible wire, and that is removed in entirety, and then the other pieces are all outside. This wire is the only thing that stays in, and the tip of that wire, earlier I showed, is a very small sliver, which is a hook-shaped sliver, which is the part that once in a while does break off and stay in you. So this is the only part that is implantable. It's thin, strong, and very flexible. So in this section, or FAQs, which were only made possible from questions provided by listeners and contributors such as yourself, to borrow a phrase from NPR. So some of the frequently asked questions are, does the battery get taped onto the body? Yes, absolutely. The battery does get taped onto the body, and so does some other parts of the implant, which is they're all contained within plastic boxes. So those all get taped and bandaged onto the body. Does the tape irritate the skin? Yes, absolutely. The tape. So some of the great questions asked are, is the battery taped onto the body? Yes, absolutely. The battery is taped onto the body. Does the tape irritate the skin? Well, tape can potentially irritate the skin. So the bandage that holds the device in place, which is basically anchored internally and on the outside with bandages, we do tend to change and remove some of the external pieces of the bandage, but the inside bandage must remain firmly in place and waterproof so that it doesn't allow germs to enter. A great question. What if the needle gets pulled out? So sometimes we have to intentionally pull out the needle, and other times it just comes out. It's just the way life is. So on a case-by-case, circumstance-by-circumstance basis, the company that makes this product may allow a replacement product to be placed at no charge. They won't pay for the labor or anything like that, which you will work out with your doctor, just depending on the circumstances. Generally, we like to put the probe back in place with minimal, So a great question was asked, what if the needle gets pulled out? So that's a great question, because sometimes we have to intentionally pull out the needle. For example, if you need an urgent MRI that can't wait 60 days, then we have to take out the battery pack, the needle, the bandages, everything, let you go through the MRI, and then come back and replace them. On a case-by-case basis, in those circumstances, the company may allow you to have a free replacement lead because they understand that their full implant lead is not MRI compatible, so it does have to be removed. Sometimes the thing just accidentally falls out or gets pulled out. Under those circumstances, the company may choose to give you a partial replacement at a medium cost, or it may be at no cost. It's just on a case-by-case basis. We will advocate as your doctors for you and figure out the best plan for you if that happens. So great questions. Can you shower? What about moisture? Well, as you might imagine, when there are wires and small batteries and things like that around, they don't perform optimally. in moist or wet conditions. So the company has taken great strides to the rep themselves will help us to bandage using some special tools that they have in their kit. So we will make a moisture barrier and as best as possible. Of course, that it is taped to your skin, so there is some care needed and some cooperation afterwards. So there are people that bathe. Most people bathe differently for 60 days, but moisture again is not entirely something that we are. So great question. What about shower and moisture? As you might imagine, if you have a wire and a small battery, moisture is not the battery's best friend. So the company will provide some tools, bandages and covers that we will place during the procedure over your skin to create a moisture barrier for 60 days. Now, depending on where that moisture barrier is, or whether it's on the back of your neck or on your shoulder or on your low back, there'll be some aftercare instructions that your rep will give, and so it is certainly possible that depending on where the position and the attachment is externally, that you can shower. Most people you can bathe, but getting the battery and the wire submerged underwater is probably just not generally something that will be in your best interest. So we'll give you very specific aftercare instructions just depending on where the battery pack and the leads are placed. Great question. Can you do this over and over and over? So in cases such as cancer, where a person has a limited life expectancy, this is actually done over and over and over because the product is powerful enough to kill pain even from cancer. And some of the cancer centers, the biggest cancer centers in the country, are using this product. And as you might imagine, if your life expectancy is not full, then it can be done over and over for that expectancy if it's limited. Typically, if you don't have a shortened life expectancy, we don't do this over and over and over again. However, certain insurance companies will allow it to be done every few months. So it just depends on the situation. Typically, we do it once or maybe a repeat and then go to a different product, either a full spinal cord stimulator or a different kind of permanent implanted device, especially if this works once or twice or maybe a couple of times. So that's typical. So what is the percentage of the needle breaking off? Great question. I can tell you in 2020 and a portion of 2021, the older product, which was started to be replaced in late 2021 and early 22, had a higher break-off rate of the tip than the newer product. So the old break-off rate was 4%, or 1 in 20 devices, that the little small tip would just remain inside. And again, the consequences to the patient of that small tip breaking inside, if discovered, is just that you have to tell your MRI company, gosh, I have a small little piece of a tip of metal inside me, so you have to go into MRI conditional mode. So you can still have MRIs, they just have to be in MRI conditional mode. So you just have to tell the person or remember to tell them that. But if even that is too much, then the good news is that the newer product, which was released in 2022 and is now available in all areas in 2023, is much stronger. It's newly designed and has a much lower break-off rate. But because it's only been around a few months, we don't actually know what that break-off rate is. That's something that we can talk to you in more detail if it concerns you. But the product has been around for years, and we know that the little tip does break off. So it's important to inform you that that can happen and what the consequences would be, and just hope that it does not ever happen. Okay, so great question. What is the exact percentage of the lead tip breaking off? Now keep in mind what we're talking about is not the horizontal needle that you see in this picture. If you look at the tip of the needle near the ear of George Washington, that little sliver going upwards that I've tried to magnify, That's the part we're talking about. That's the little hook that stays inside the body that keeps everything in place. So when you pull the lead out at the end of 60 days, once in a while, that little tiny sliver hook will stay in place. That's the lead tip. So in 2021, I can tell you that percentage was around 4%, or 1 in 20 that little hook stays implanted, and then the consequence of that is that you would need to make sure you tell your MRI provider, if you have an MRI, that you do have a piece of metal inside you, however small, and they would just change the settings to MRI conditional, and you could proceed. But in 2022, the company made a new innovative product that's stronger, and the tip doesn't break off as easily. We don't have a lot of data for this in 2022 and 2023, but as the years progress, the data will emerge, and we believe that it will have a much lower breakage rate than 1 in 20, but we're still talking about that little tiny tip or hook that keeps it in place. So that's just something to keep in mind. Great question. Thank you for asking that.